Real Country 1430 AM and 1073 FM WRDN. I'm Brian Winnekins. Joining us this morning, Meghan Sickel with the Pepin County Health Department. We're going to talk a little bit about the warm weather that we're having and some safety tips on that, especially for our seniors as well. And also the air quality alerts that we've been having. Meghan, thanks for joining us this morning. Well, we have the Dunn County Fair going on this week. And of course, now we're getting some very hot weather. And this type of weather is something that, especially, well, it doesn't matter if you're older or not, you've really got to be kind of watching yourself outside, right?
Absolutely. Any age, anyone, any person can get affected by the heat. Pets also are really affected by the heat at this time of year. It's getting muggy. We're hitting the 90s. We're hitting some highs that we haven't seen all summer. So it's really important, especially if you plan on being outside for any county fairs upcoming this weekend or later in the summer. It's really important to stay hydrated with water or beverages that do not have sugar, caffeine, or alcohol. Also, staying indoors is probably best, staying in that air conditioning. So if you need to take a break and you can tell that you are really not handling the heat very well, go inside a building, cool off, and kind of recuperate at that point. And also learning the signs of heat stroke or any heat related illness. So knowing the signs and symptoms for not only yourself, but for those around you, making sure that the person you might be going to the fair with is also doing okay, that they're staying hydrated, especially if that is a child or a senior citizen. And then lastly is making sure that your pets are staying hydrated as well, making sure that you're carrying around a portable bowl or carrying around a portable water for them to drink out of. And if the pavement is too hot for you to stand on, it's too hot for them to stand on. So either leave your furry friends back home in the nice air conditioning where they can take a nap, or make sure that they're staying in shade, they're getting air conditioning regularly, and that they're getting water.
Talking with Meghan Sickel with the Pepin County Health Department this morning. Meghan, you talked about heat stroke. What are the symptoms of heat stroke in folks?
Yes, so that's a great question. I have a phenomenal kind of chart of what the symptoms of heat-related illnesses are. So first, it's heat cramps. It just means that you're sweating a lot and you're getting muscle cramps. It means that you need to stay hydrated, you need to stop activity for a few hours, recuperate, and seek medical attention if those cramps do not stop within the next hour. Heat exhaustion and heat stroke are the most common that we see among people. So heat exhaustion is heavy sweating, weakness, fatigue, headache, dizziness, any nausea, vomiting, fainting. You want to move that individual to an air-conditioned environment, have them laid down, and make sure that they're wearing loose clothing or changing to any lightweight clothing to help them cool down a lot faster. Make sure that they're sipping on cold beverages that is not alcohol. And it could also help for them to take a cool shower for them to cool down. Cold water is great to make sure that your body temperature gets down to the normal temperature that it should be. Heat stroke is when we really start to worry. Heat stroke causes a lot of deaths in the US. It is the #1 weather induced death in the United States every year. So heat stroke means a very high body temperature, an altered mental status, throbbing headache, confusion, nausea, dizziness, and then ultimately the person might lose consciousness. At that point, you need to call 911 immediately and follow the operator's directions, because they will give you directions on how to properly care for the person until help arrives. Reduce the person's body temperature with whatever methods you can, wrapping them in a cool cloth, immerse them in a cool bath, or spray them with cold water from like a hose, trying to get that body temperature down as soon as possible. And then moving that person to a cooler place once you get their body temperature down a little bit more. And this is the most important part, is do not give fluids, because if a person is unconscious, you don't want to give them fluid. They might choke, they might aspirate. That's going to make the situation worse. And if they have uncontrollable muscle twitching, just keep them safe. Do not place any objects near their mouth. And if they are vomiting, turn them on to their side to make sure that they don't choke.
Talking with Meghan Sickel from Pepin County Health Department this morning. Meghan, the other issue that we've been dealing with all summer so far has been the poor air quality. How is that affecting folks, and what are some things that folks should be thinking about with that?
Yeah, so this haze that we've all have noticed when we walk outside due to the Canadian wildfires occurring so far since May has been affecting pretty much everyone. You might have noticed that your eyes might feel a little itchy or irritated when you walk outside, or your throat kind of feels kind of gross when you breathe in that air. It might smell a little funny outside. What people are breathing in is called small particulate matter. There's a specific name for it, but we won't get into those kinds of details because people don't need to know that. But basically, what those particles are going to do is that they can get into our lungs and they can cause tissue damage if we are exposed to those over a long period of time. And so those who have really underlying conditions like asthma, COPD, any heart disease, the elderly, children, especially children under 4 years old, they're going to be the most affected by those toxins or those particles in the air due to the wildfires. And so it's really recommended that if anyone who is in these high risk groups, that they reduce their amount of time outside, that they do not do any heavy activity, that if they do need to be outside and they are doing heavy activity, for example, for work, or if someone is not part of those high risk groups, but they're working outside continuously all day, to wear a mask. So I know we don't want to hear the masking again because we just got out of the pandemic, but N95s are really phenomenal and they are very protective against those harsh particles that can get into our lungs that can cause that shortness of breath, coughing, kind of like that elephant on the chest sort of feeling. The Pepin County Health Department, we do have free N95s left over, and we would be happy to hand those out to individuals who might need them to just help get them through the rest of the wildfire season until those are under control.
That is Meghan Sickel. She's with the Pepin County Health Department, and you're listening to WRDN.